Welcome to the Introduction to Insulin Pump Therapy online learning module, presented to you by the Barbara Davis Center for Diabetes. In this online course, you will learn the basic principles of how insulin pumps work and different pump terminology. You will learn about the next steps in starting your pump and ordering supplies. You will learn about practical tips, including using the pump at school, as well as important safety principles. Once you are finished with this online course, you will be able to schedule your live pump training, where you'll learn more about your specific pump. This is your only pre-pump education before individual pump training.
Pumps are great because they mean fewer shots. With a pump, you only need to insert the infusion set once every 2 to 3 days, instead of giving multiple injections each day. Pumps are great because they are more efficient. Your pump will give you tiny doses throughout the day and night that take the place of long-acting insulin. It can even deliver super small doses, as small as 5/100ths of a unit per hour. Pumps are great because they give you more freedom and flexibility. With a pump, you will always have your insulin on you. This is convenient if you are athletic, active, or always on the go. Pumps are great because they are more discreet. Pumps deliver insulin at the click of a button and can be hidden by your clothes. Pumps are great because pumps are smart. When used correctly, pumps do some of the work for you, like calculating your correction and meal boluses. When used with a continuous glucose monitor, or CGM, pumps adjust your insulin delivery automatically based on the glucose values and trends.
How does an insulin pump work? There are 5 insulin pump models available in the United States today. Those include the MiniMed 780G, which is made by Medtronic, the t:slim X2, which is made by Tandem, the Mobi, which is also made by Tandem, the Omnipod 5, which is made by Insulet, and the iLet, which is made by Beta Bionics. On these next slides, we will review the parts of an insulin pump. On this slide, we will review pumps that include an infusion set and tubing. All pumps include a reservoir that holds insulin. Insulin is delivered into the body through a small plastic tube called a cannula that is inserted under the skin. Pumps with an infusion set include the infusion set, which is held in place on the body with adhesive, the cannula, which is inserted under the skin, and the reservoir, which holds the supply of insulin. Pumps without tubing, or patch pumps. Patch pumps are attached directly to the body with adhesive. The reservoir and cannula are a part of the patch pump. So patch pumps are pumps without tubing. The reservoir is included inside the patch, which is attached to the skin with adhesive. The cannula is inserted under the skin. A controller device is used to communicate directly with the patch pump.
Wearing an insulin pump. Insulin pumps can be worn on the body in a variety of ways. Insulin pumps can be worn inside of pockets. Belt clips allow insulin pumps to be clipped to a waistband or a pocket. Sport belts provide an extra pouch or pocket in which to store your insulin pump. Some pumps provide on-body options for wear. Be flexible and patient as you experiment with different ways of trying to wear your pump until you find the method that best suits you. Insulin pump therapy. Insulin delivery. There are two types of insulin delivery: basal and bolus. Basal insulin. Basal insulin is background insulin that your body always needs, even when you are not eating. Bolus insulin. Bolus insulin is larger doses of insulin that are delivered for meals and high glucose correction.
Basal rates. The amount of basal insulin your pump delivers per hour is your basal rate. You can set different basal rates throughout the day and night. If you need more insulin while you are sleeping than when you are active in the afternoon, then you can adjust your basal rates to meet these needs. You do not need to take long-acting insulin when using an insulin pump. This is because your pump will give you small doses of rapid-acting insulin all day and night. If you remove the pump, you no longer receive basal insulin and your glucose will rise.
Bolus insulin. Insulin you take for meals and high glucose correction is called a bolus. Bolus insulin given for carbohydrate is referred to as a meal bolus. Bolus insulin given for high glucose correction is referred to as a correction bolus. Bolus calculator. Pumps have a bolus calculator that calculates the amount of insulin you should deliver based on the total grams of carbohydrate you plan to eat and your current glucose level. In the bolus calculator, you will enter the grams of carbohydrate you are going to eat and your glucose level, and the pump will calculate the dose. It will determine whether a correction is needed based on your current glucose level and the amount of active insulin in your system. Bolus calculator settings. These are the settings utilized by Omnipod, Tandem, and Medtronic pumps to calculate the amount of bolus needed. The terminology used by the bolus calculator settings include insulin to carbohydrate ratio, correction factor or sensitivity, insulin duration or active insulin time. Insulin to carbohydrate ratio. This is the grams of carbohydrate covered by 1 unit of insulin. For example, this may be written as 1 unit per 10 grams or 1 to 10 grams. Correction factor or sensitivity. This is the number of points glucose levels will drop from receiving 1 unit of insulin. For example, this might be written as 50 milligrams per deciliter or 1 unit per 50 milligrams per deciliter. Insulin duration or active insulin time. This is the amount of time insulin is actively working to lower glucose levels.
Additional bolus calculator settings utilized by Omnipod, Tandem, and Medtronic pumps include active insulin or insulin on board, target glucose, and insulin stacking prevention. Active insulin or insulin on board, IOB. The pump uses insulin duration to track how much insulin is still working or is still active in the body at any given time. Target glucose. This is the glucose value the pump aims for when calculating a correction bolus for high glucose levels. Insulin stacking prevention. The active insulin or IOB amount is subtracted from correction boluses to help prevent insulin stacking. Bolusing with an eyelet pump. The eyelet pump works differently and does not require a bolus calculator or bolus calculator settings. With an eyelet pump, you will announce meals. Instead of dosing for grams of carbohydrate and glucose level, you will announce meals as breakfast, lunch, or dinner. Meal size. Meals will be announced according to the meal size as usual, smaller than usual, or larger than usual. Carbohydrate awareness. While no carbohydrate counting is needed with the eyelet pump, awareness of which foods have carbohydrate and what meals are usual, smaller than usual, or larger than usual is required. There are two types of modes on pumps, automated mode and manual mode.
Automated mode and manual mode insulin pumps. There are 4 insulin pump models that are able to operate in both automated mode and manual mode. These include the MiniMed 780G, which is made by Medtronic, the Omnipod 5, which is made by Insulet, the Mobi, which is made by Tandem, and the t:slim X2, which is also made by Tandem.
The eyelet pump does not have manual mode available and only operates in automated mode. Automated mode requires continuous use of a compatible CGM.
Automated mode. All pumps, including pumps made by Medtronic, Tandem, Omnipod, and iLet, have an automated mode. In general, using your pump in the automated mode will result in better glucose control than the manual mode. You must be using a compatible CGM to use your pump in the automated mode. The pump will work with the CGM to adjust insulin delivery up and down depending on how the glucose levels change over time. All automated insulin delivery pumps, or AID pumps, automate basal rates based on current CGM values and trends. If glucose is rising, insulin delivery may increase. If glucose is falling, insulin delivery may decrease or even temporarily pause. Some pumps automate correction bolus doses in addition to basal insulin. The user always still needs to enter information into the pump to deliver bolus doses for meals, as meal bolus insulin is not automated.
Manual mode. Manual mode is available with Omnipod, Tandem, and Medtronic pumps only. iLet pumps do not have a manual mode. The pump delivers the basal rates that are programmed into the pump continuously for manual mode. The pump delivers bolus insulin when the user enters the grams of carbohydrate and a glucose level into the bolus calculator. Users can also deliver a manual bolus without the calculator function. The pump does not adjust insulin delivery, regardless of how the glucose levels are changing at the moment when in manual mode. Safety on an insulin pump. Safety on a pump. Change your pump infusion set or pod site regularly to avoid running out of insulin, to prevent the risk of getting a pump site infection, and to allow for good insulin absorption. It is recommended to change your pump infusion set or pod every 2 to 3 days, or earlier if your glucose is high and doesn't come down from a correction bolus. A calendar for pump infusion set or pod changes may help you plan site changes. Pumps come programmed with site change reminders. These can be adjusted in some pumps. Before an infusion set or pod change, you will need a vial of room temperature insulin. Cold insulin tends to cause tiny bubbles in the tubing. You will need an infusion set or pod. You will need a cartridge or a reservoir, and you will need alcohol swabs or IV prep. Be sure to clean your hands. Use a clean work area and clean your new pump site with alcohol prep or soap and water to avoid an infection at the pump site. After an infusion set or pod change, always monitor your glucose levels for the 2 hours after you have inserted a new infusion set or new pod. This will allow you to detect a pump or cannula problem. Always check your glucose level before bed. A malfunction can occur at any time, so you want to detect any problem before going to sleep. Problems that may result in the need for an infusion set or pod change or require more immediate attention include a kinked cannula, air bubbles in the tubing, a set that has hit a blood vessel, or a pod with blood in it. Daily pump and infusion set or pod checks. When you wake up and when you go to bed, check the area around your pump infusion site or pod site and check for the following: redness, tenderness, swelling. Although rare, any of these could be signs of infection or mean that you are not receiving insulin. If infection appears to be present, change your infusion site or pod site and call your doctor. Check for remaining battery power. Check for the amount of insulin left in the reservoir. And check for bubbles in the tubing.
Pump site rotation. It is important to rotate your pump sites to avoid tissue overgrowth under the skin. This tissue overgrowth can affect the absorption of insulin. If insulin is unable to get into the body well enough, high glucose levels may result, and your risk of ketones and diabetic ketoacidosis, DKA, increases. An ideal pump site is at least 1 inch away from a recent site, at least 2 inches away from your belly button, at least 2 inches away from your continuous glucose monitor, or CGM. An ideal pump site is an area with some fatty tissue under the skin. You want to avoid a pump site that is under a waistband. You also want to avoid a pump site that is over a bone or blood vessel or on top of scar tissue or surgical scars. Diabetic ketoacidosis, DKA. DKA can result from an infusion site failure. An infusion site failure is when insulin does not flow through the infusion cannula into the body well enough. Causes of infusion site failure. An infusion site failure can occur with a bent cannula or cannula that has come out from under the skin. This will result in insulin not absorbing well in the body. Ketones. Ketones can form quickly when infusion sites fail because insulin pumps do not use long-acting insulin. This increases your risk of developing diabetic ketoacidosis, DKA. DKA symptoms. Symptoms of DKA include frequent vomiting, stomach pain, confusion, and rapid breathing.
Diabetic ketoacidosis prevention. To prevent DKA, you should use a CGM to monitor glucose levels or check blood glucose levels at least 6 to 10 times daily with a blood glucose meter. You should treat unexpected highs promptly. You should test for blood or urine ketones if blood glucose is over 300 for 2 hours or more. Sick day management. Use a CGM to monitor glucose levels. You may need more or less insulin than usual. You will always need basal insulin, even if you do not eat. Stay hydrated. Although it may be difficult, it is important to keep hydrated and maintain adequate calories when sick. Take medicine. Even if it causes a rise in blood glucose, take all medicine recommended. You may just need to take extra insulin. Always check for ketones when sick. If ketones are present, follow your sick day plan or reach out to a nurse at the Barbara Davis Center main line. 303-724-2323. Always have glucagon nearby. Practical tips when starting a pump.
Pumping at school. Determine who will assist with injections, boluses, and low glucose, high glucose, and ketone treatment and management if needed. Meet with the school nurse to teach them how to use your child's pump. For example, how to give a bolus. Provide the nurse with a healthcare provider order for student with diabetes on pump form. This you can access from your MyChart. Like with injections, consider a 504 plan to make special accommodations at school for students with disabilities.
Ordering pump supplies. Depending on your pump, you may get your pump supplies from a pharmacy. For example, this is common with Omnipod pumps. You may get them directly from the pump company, or you may get your supplies from a third-party durable medical equipment supplier, referred to as a DME supplier. Important. Always have long-acting insulin in your fridge in case your pump malfunctions. Check the expiration date from time to time and refill it, even if you didn't use it before it expired. If you have any questions regarding copay and coverage, contact your pump representative or the Barbara Davis Center. Review. Insulin pumps deliver small doses of rapid-acting insulin continuously throughout the day, which is called your basal rate, and larger doses of insulin as needed for meals and high glucose correction, which is referred to as a bolus. Insulin pumps contain a reservoir that holds insulin, and insulin is delivered into the body through a small cannula inserted under the skin. Clean your skin before inserting your infusion set or pod to avoid an infection. Change your infusion set or pod every 2 to 3 days, rotating locations. Check ketones if blood glucose is over 300 milligrams per deciliter for more than 2 hours. Give an injection and change the infusion site if ketones are moderate or large. Develop a pump plan with your school and teach the school how to use your child's pump. Keep long-acting insulin on hand in case of a pump malfunction. Nice work! You have completed the first step in the pump training process. To move forward, you must have your pump in hand. Once you have your pump, contact the Barbara Davis Center to schedule pump training. Once you have your pump, please send an email to bdcpumptraining@cuanschutz.edu. Please provide us with the following information: the scheduling code BDC Pump 123. This confirms that you have completed the pump training course. Please provide us with your child's full name and your child's date of birth. Let us know the training preference you have. We can offer in-person training at the Barbara Davis Center or remote training via a Zoom call. Please provide us with the amount of long-acting insulin units your child currently takes and whether you give it in the morning or the evening. Please let us know the insulin to carb ratios for all meals for your child. Let us know the current correction factor that you use. And let us know the pump type that your child will be starting on. If the pump type is an Omnipod 5, there is an additional step that you need to complete before scheduling training. See the next slide if your child will be starting on the Omnipod 5. For Omnipod users only. Once you have your pump, Omnipod users must complete an Omnipod onboarding before scheduling the pump start appointment. To do this, please scan the QR code at the bottom of this page or follow this link, www.omnipod.com/setup. Thank you. Please contact BDC Pump Training at cuanschutz.edu with any pump-related questions or concerns.